This is ITV, certainly the best.
Many thanks again for staying with us on your ultimate news and current affairs program on television this morning on ITV. We have two special guests in the studio. They'll be sharing some thoughts with us on a big event coming up at the Nigerian Premier Private University, Igbinedion University Okada, on the 21st of June at the Igbinedion University Okada. The Coalition for Dialogue on Africa will be launching the Independent Task Team on Vaccine Development, Equitable and Universal Access to Vaccines and Vaccination in Africa. And to help us make sense of this, I'd like to thank very especially Professor Authur Mutambara, former Deputy Prime Minister of Zimbabwe. Your Excellency, thank you for joining us on the program. Thank you. We also have with us in the studio the Chief Medical Director of Igbinedion University Teaching Hospital, our very own Professor Nosakhare Bazuaye. Thank you for joining us on the program.
Thank you very much, Onido. Nice to be here.
Let's learn a little bit more about our guests in the studio before we go into the conversation this morning. Professor Authur G.O. Mutambara is a professor, is an independent technology and strategy consultant based in South Africa. He is also a visiting full professor at the University of Johannesburg, where he is responsible for establishing and directing the Strategy and Institute for African Agency in Public Health. His other major areas of consultancy, research and advisory work include consultancy to both private and public entities on thriving under COVID-19 and beyond COVID-19, new business models, new leadership imperatives, organizational redesign, and use of data, analytics, and technology. Mutambara is the former Deputy Prime Minister of Zimbabwe, as I said before. He is the author of a new trilogy, In Search of the Elusive Zimbabwean Leadership. He was one of the three principals who created and led the Government of National Unity, GNU. The other two were Prime Minister Shangarai and President Mugabe, who was recently the president of the African News Agency. He is a chartered engineer, a fellow of the Institute of Engineering and Technology, IET, a professional engineer, a fellow of the Zimbabwe Institute of Engineers, ZIE, a fellow of the Zimbabwe Academy of Sciences, ZAS, and a senior member of IEEE. He was a research scientist at NASA, visiting professor at MIT, professor of Pharma FSU, and a management consultant with McKinsey & Company. Professor Mutambara holds a PhD in robotics and mechatronics and an MSc in computer engineering, both from the University of Oxford, where he was a Rhodes Scholar. He graduated with a BSc honors in electrical engineering from us. In 2007, Mutambara was accorded the World Economic Forum WEF Young Global Leadership Status and subsequently attended WEF events from 2007 to 2013 in Davos, China, India, and Africa. Ladies and gentlemen, I'd like to thank very especially Professor Mutambara for joining us on this live conversation. Thank you for coming.
Thank you very much.
Let me just give you an insight about our very own Professor Nosakhare Bazuaye, who is currently the Chief Medical Director of Igbinedion University Teaching Hospital Okada, the first private university teaching hospital in Nigeria, a certified stem cell transplantologist, and a clinical apheresis of the Basel Teaching Hospital, Switzerland. Professor Bazuaye pioneered the first successful stem cell transplant in sub-Saharan Africa for the cure of sickle cell disease in 2011. The first automated red cell exchange in Nigeria for sickle cell disease in 2014, and the first automated stem cell transplantation for blood cancer, multiple myeloma. Is currently collaborating stem cell transplantologist with the first and only private stem cell transplant center, the Certec Healthcare Medical Center in Sub-Saharan Africa, where he has performed 12 stem cell transplantation for patients with sickle cell disease, 2 multiple myeloma, and 1 aplastic anemia patients. Professor Bazuaye has co-authored books, published several research articles, and won several academic and professional awards. He is a distinguished alumnus award recipient of the University of Benin in Nigeria, a postgraduate examiner at the National Postgraduate Medical College of Nigeria, external examiner for several medical schools, and a reviewer of several local, national, and international journals. Professor Bazuaye is a member representing Africa in the board of the World Blood and Marrow Transplant Society and director of European Blood and Marrow Transplant for Nigeria. He was dean of the School of Clinical Medicine, College of Health Sciences, Igbinedion University Okada, and first Black African Quality Manager and International Inspector at the JC Accreditation of Transplant Centers in Europe and America. Gentlemen, once again, thank you for coming on the program.
Thank you very much, Sanidu.
Okay, let me begin from the foundation of this conversation. I'd like to begin with His Excellency. The Coalition for Dialogue on Africa as it relates to development of vaccines, access to universal vaccines and vaccination. How did CoDA come about? How was it formed?
Basically what we're saying is COVID-19 has been a very unique opportunity for Africa to realize our unpreparedness, to realize our weaknesses.
Okay.
With the advent of the pandemic, we will find that the availability of vaccines, the availability of testing technology, Africa has been depending on the goodwill of other nations, has been depending on the benevolence of other nations. And we are saying never again should the African continent be unprepared for pandemics. So we are trying to come up with answers for COVID, but more importantly for future pandemics, so that when we do have future pandemics, Africa has available vaccines. So the topic, the idea is universal and equitable access to vaccines and vaccination. Number one, let us have vaccines being available on the continent. Number two, once we have the vaccines, can we make sure we distribute them and they get into people's arms? And so our idea, our motivation as CoDA is to say, can we work together as Africans and make sure that going forward, we have research and development on the continent around vaccines. We have the manufacture of vaccines on the continent. And having done that, we also solve the issues around the logistics, supply chain, procurement, the distribution of the vaccines, so that we have equitable and universal access to vaccines. So we are concerned about COVID-19, but more importantly, we are saying going forward for future pandemics, we should never be found wanting as Africans. We must not depend on the benevolence of other nations. We must defend ourselves. Vaccine self-sufficiency, vaccine sovereignty is the idea and agenda for CoDA on this matter.
So CoDA came into existence largely because of the COVID-19.
CoDA has been in existence before. CoDA is the Coalition for Dialogue on Africa.
Okay.
They've worked on illicit financial flows, wealth management, natural resources. So CoDA has been in existence about conversations and dialogue of Africa. On this particular issue, we are now addressing the issue of availability of vaccines and the vaccination itself. So that is how CoDA comes in. But CoDA has been there before. This is a project of CoDA.
Okay. Professor Bazuaye, what is the capacity of this organization CoDA with Igbinedion University Okada coming in to midwife this process of having vaccines developed in Africa, and then there is universal equitable distribution of vaccines and vaccination?
Well, as said by the Deputy Prime Minister, several questions have been left unanswered with respect of the pandemic.
Okay.
And that has shown us the a lot of deficits that we have in Africa in terms of doing things properly. And that question was one of the questions the Chancellor and some other very senior leaders in the country have also asked. What is Nigeria's role in terms of being able to provide vaccines for both Africans and even the possibility of being able to export these vaccines outside Africa? So that's where the coalition came in between CoDA and IUTH and IU. Now the essence is that they needed a platform where some of these ideas could be put into practice. And I think the Igbinedion University Teaching Hospital and Igbinedion University being the premier university in Nigeria. And don't forget too that most of these collaborations, they'll be going on with government establishments. And the way to go is actually with respect to private collaboration. So this collaboration between CoDA and IUTH-IU is to have a private look at the solution to these problems. And what we've done in IU and IUTH is to provide a platform for CoDA. We are establishing a center of excellence at IUTH. And this center of excellence is to look at research, training, manufacturing, producing, distribution of vaccines. So the essence is have a center of excellence so that in case of other pandemics, and not only COVID, we have other problems in Africa. Things like Lassa fever and Ebola and other areas. So we're hoping that this research center, which is going to be a center of excellence at IUTH, will be a center where research will be done, not only on COVID vaccines, but other vaccines, and be able to produce vaccines for Africans to meet African needs. And don't forget too that we're always at the mercy of foreigners bringing us vaccines. We want to be able to research, and Africa is blessed with a lot of genetic heterogeneity, meaning we have the ability to research and do so many things. So we're catching on this, establishing a center of excellence, which will be launched on the 21st of June. And from there, we're going to start training scientists. We're going to start establishing centers where we'll be able to do more than even vaccine, to be able to produce other things that will bring succor to Nigerians and even Africans at large.
Where does the independent task team come in as far as this whole matrix of discussion is concerned?
The team is saying, what is the Africa strategy in terms of vaccines? What is the strategy in terms of vaccination? Let me give you the scale of the problem. Right now, Africa is producing 1% of our needs. Of all our demands, of all our needs around vaccines, we're only producing 1%. 99% is coming from elsewhere. That is health insecurity. And once you have health insecurity, you have national insecurity. We're saying as Africans, we don't want to be insecure with respect to vaccines. Now, how do we go about this? We're saying now, in terms of vaccines, as indicated by Professor here, there are two things. It's health, physical health, but also there's commerce involved. Right now with COVID-19, there's serious money being made in Europe and America around vaccines. Serious money. And we're saying the African must also be a participant in the commerce around vaccines. Okay. When we produce vaccines on the continent, we're going to create jobs. We're going to have businesses. Our economies are going to prosper because vaccine manufacturing, vaccine R&D is business. So in addition to solving our challenges around health, we're also going to be part of the commerce, part of the economics. And we want to be able to produce vaccines for our consumption and also for export, so that we can actually be part of both the health side of the equation and also in terms of the business. And so where do we come in? We are saying, yes, Nigeria will be an ideal place for us to actually have a lab, to have a manufacturing plant. But that plant is for ECOWAS. That plant is for the continent. So what we're doing in Nigeria is what we call proof of concept, demonstration that the idea works, that Africans can do research and development around vaccines. Africans can manufacture vaccines. If we can do it in Nigeria, it will be a good demonstration that Africans have the capacity to do R&D and produce their own vaccines, which will service Nigeria, service ECOWAS, but more importantly, service the continent. So as CoDA, we have an Africa-wide agenda, and Nigeria is a demonstration of the efficacy of the idea.
Prof, would you highlight further the core objectives of the independent task team? Yeah.
Okay. Now, the essence is that, as mentioned by Professor Mutambara, is to begin to do something from various geopolitical zones. And then we're picking West Africa as a prototype. And now, actually, they have been appointed as the chairman of the West African tax team. Now, the tax team is a collection of brains. I represent the scientific part of the tax team.
Okay.
And then Mutambara, apart from being a politician, is also into robotics and into computer science too. So we have other persons involved, those from CDC, those from the political wings. So the tax team is a collection of brains across both the political, scientific, and both educational. So we have those who are into educational part of training for vaccines, and we have those who are in the scientific area, we have those in the political area. So this group of things, I'm a part of it, he's part of it. We have other members of the tax team that will be inaugurated. The essence is to give us, the mandate to begin to start the research and training, production and manufacturing for vaccine. As I mentioned, the Center of Excellence we are creating will not only talk about just production and research of vaccine. The Igbinedion University component, we are war tickets. We want to be able to train Nigerians. We want to be able to train Africans. As I mentioned, we're using Nigeria as a platform. And then we begin to train Africans the act of research, manufacturing, production of vaccine and distribution. So the tax team is a collection of scientists, politicians, businessmen, educators to ensure that we have this dream and then we drive this dream to an extent where the Center of Excellence will begin to produce, train, and have what it takes to have Africans have their vaccines. That's the target.
All right, let me come to Prof again. What is the structure in place to be able to fund this project? Of course, you know that vaccine production is capital intensive. Is this going to be restricted to Africa and Africans alone, or is there a foreign support maybe through the Center for Disease Control and all of that?
Very important question. Everything rises and falls on finance. Resources equal results. We agree with that. Now, so what we're trying to do is to say, what should governments do to incentivize the private sector to invest in research and development? What should governments do to incentivize the private sector to invest in the manufacturing of vaccines? What should governments do to ensure that the banking sector, the international financial institutions find it viable for them to put money into research and manufacture of vaccines? So the CoDA task team is coming up with policies, coming up with frameworks to encourage governments to put policies in place that will encourage the private sector to play a role. We are also motivating and coming up with policies that will encourage the private sector to see value, to see the economic side of vaccine manufacturing in Africa. And so finance is going to be very important. But guess what? One thing that we're saying differently is that he or she who plays the piper pulls the tune. Yeah. So we want African money, African philanthropists, African business people, African private sector to fund our R&D, to fund our manufacturing. Because if we leave it to some Europeans and some Americans, they will end up telling us what to do and what not to do. We want what we call African agency. And the African agency is a function of us funding our own activities. So the primary source of money into R&D, into manufacturing, into building supply chain, distribution network must be African, so that we control the agenda, we control the content and output of our activities. So one of the major tasks of the task team is to see how we can mobilize, how we can incentivize resources from Africa to fund R&D, to fund research, so that we can control. Because guess what? If we leave it to big pharma, the global pharmaceutical companies, if we leave it to America and Europe, they would rather us be recipients of donations, recipients of vaccines on their benevolence, on their goodwill. So for us to actually do R&D in Africa, to do manufacturing, we must put our money where our mouth is. We must walk the talk financially and African resources must fund our activities.
What's the level of involvement of the African Center for Disease Control? I mean, level of collaboration or cooperation with CoDA?
Well, I would say that we are independent of them.
Okay.
They are doing good work. What we do, we complement their activities. In some cases, we do things that they are not doing. So we are an independent entity from Africa CDC. We respect their activities, but we're here to address what they're not doing. We're here to address the missing dimension, and also we're independent of US CDC. We're independent of WHO. We're independent of European money. We're Africans, primarily. And our agenda is to say, can we put Africa at the center of our discussion? Can we be driven by Africa, not Europe or America, driven by Africa? So that's the difference there.
Okay. Prof, to what extent would you, how would you describe the level of competence and capacity for Africans, using Nigeria as a case study, to midwife this process of vaccine development in terms of capacity?
Yeah, you recall that we've always said that Nigeria has what it takes in terms of capacity, in terms of the knowledge. What we require is the appropriate platform. I will also let you know that it was postulated before that transplant, for example, stem cell transplant cannot be done in Africa because of so many factors. And that genes, we broke it in 2011 when we performed the first stem cell transplant for the cure of sickle cell.
I remember that vividly.
Yes, so what we're saying is that with the right support and the right platform, Nigeria has what it takes to be able to do anything. Now, if you go to some parts of Europe and America, you discover that Nigerians are usually involved in some of this high technology. And so what we tend to do in this coalition, we're not going to just sit down and stay in Nigeria and look for, we're actually saying that we're going to coalesce several individuals, brains within and outside Nigeria, outside Africa, who are Africans, who have this philosophy to know that we need to build Africa. And you can also see too that with the event of this COVID, people are beginning to understand that if you don't build your home in terms of healthcare, you're going to become vulnerable. And our leaders are already vulnerable because right now you cannot go anywhere. Most places are under lockdown. So there is a need for us to start this process. And as I said, we have what it takes. Nigerians are one of the most brilliant persons in the world. We have Africans who are also very smart. We're going to get all the brains together. And I can assure you that with what we believe, that Africans have what it takes, both in terms of knowledge. As I has mentioned, we are also not going to reach out to Africans to let us know that we need to build our homes. We need to put forth in terms of research. And we're very certain that we have what it takes to start this process.
Prof, what's the level of preparedness for this task team grand launch that is forthcoming?
You know, we've done our research. We've looked at what is going on in the continent. Where are we doing some R&D? Where are we doing some manufacturing? In about 7 countries: Morocco, Senegal, South Africa, Nigeria, Rwanda. We've done the mapping of the current activities. We've done a SWOT analysis of the current activities, and then said, okay, given what we know, what is the way forward? Given what Africa CDC has done, what is the way forward? So we've done the background work, and hence we're coming up with the Africa strategy. How can Africa become a master in terms of vaccines and vaccination? What is the vision? What is the strategy? We've done that. And then we say, why don't we use Nigeria as a case study, as a demonstration of proof of concept? And then beyond Nigeria, the entire continent. Let me emphasize what he just emphasized by the professor here. There's so many Africans in America, in Europe, working for Pfizer, Moderna, working at MIT, at Harvard. There are many Africans who are very able, who are working in European institutions. We want them to come back or to collaborate with us and drive the African agenda. We are not short of expertise. We are not short of capacity as Africans. The only problem is we are uncoordinated. With brilliant Africans all over the world serving other nations and not serving Africa. CoDA's task team, the agenda is to say, why don't we bring these Africans to one place in Nigeria as a starting point and use that African expertise to do R&D, to do the manufacture of essential medicines, essential vaccines on the continent. And having done that, then we can make sure we have a model for the whole continent. What we're realizing is Africa cannot depend on the goodwill of France, on the benevolence of the Americans for our national health. Our national health, our continental health is far much more important, and we must invest in it. But more importantly, what's different is that we're moving away from the emphasis on the national solution. We don't have the numbers. Some countries, Nigeria has got the numbers, but some countries in Africa, 15 million, 20 million, you can't work with those numbers. Let's have a regional strategy with an ECOWAS strategy around vaccines, with a SADC strategy around vaccines, East African Community strategy, and then a continental AU strategy. That way, we can leverage scale and scope. Why are we saying this? When we look at the continent, we're talking about 1.3 billion Africans. We're talking about a collective GDP of $2.5 trillion. Those numbers and scale will allow us to be able to manufacture vaccines on the continent, be able to consume them, and also be able to export the excess. So one thing that is different in terms of our approach as CoDA is to say, let us move away from national sovereignty and emphasize regional sovereignty, the ECOWAS sovereignty. Let us move away from national sovereignty and emphasize the SADC sovereignty as opposed to Zimbabwe sovereignty. But more importantly, let us move away from the national sovereignty and talk about continental sovereignty, where Africa becomes our unit of analysis. I'm saying to you as a Nigerian, can you say, I'm an African first, and then second, a member of ECOWAS, then Nigerian third? Okay. So the psychology must move away from the nation to the continent. When we do that, you can see that we can achieve whatever we want because we have the numbers. When we produce the vaccines in Nigeria, we have a market of 1.3 billion Africans for that vaccine. When we talk about the commerce, we're talking about a collective GDP of the continent, which is $2.5 trillion. So psychologically, what we're trying to do as CoDA is to shift our people from an emphasis on the nation to the continent. Yes, Nigeria must do well, yes, Zimbabwe must do well, but actually to achieve that, we must work together as Africans, 1.3 billion Africans.
Fantastic. I'd just like to ask this question, but I also like Prof to respond to it. Over the years, we've had a disease like malaria that has bedeviled Africa. And questions have arisen over the years. Why haven't we been able to develop vaccines to deal with that? And Prof said a while ago that CoDA has been in existence even before COVID came on board. There are concerns that maybe, just maybe, there could be influences against the background that the CoDA task team, independent task team, is coming into reality largely because of the outbreak of the COVID-19 pandemic. So the question is, how come we haven't had the will to develop vaccines for a disease like malaria all these years, and now we're focusing on COVID-19? And in a sense, when you look at the numbers in Africa as it relates to COVID-19, it's relatively low compared to the numbers as it relates to a disease like malaria. I'd like to get a perspective on it, but I'll come back to Prof on it as well.
Okay, yeah. I will just talk about that. Talk about our preparedness for the 21st.
Yes.
Now, yes, CoDA has been there, as I mentioned, looking at other areas. Now, the COVID pandemic became more like an eye-opener to everybody. Okay. That there is need to be able to do research and vaccine in most areas. And as I said, this center of excellence that we are establishing in IUTH-IU is not going to be a center of excellence based on COVID vaccine. It's an eye-opener that we can actually do research into several other local problems. And nobody is going to solve the problem for you.
Yeah.
Now, if you look at America, for example, the budget the American government has for sickle cell, for example, is far more than what the Nigerian government, who looks into sickle cell. Nigeria has the highest number of sickle cells in the world, but America has a lot of budget for that. So what we're saying is that this coalition, this eye-opener is going to be able to trigger so many things, including research into vaccines for malaria.
Okay.
So we're saying that, it's better to start late than not to start at all. Now that we have started, we're going to do research into several things. I mentioned Ebola, I mentioned Lassa fever. So all these are areas we feel that are peculiar to us. And we need to, as Africans, be able to look at it closely and be able to find solutions to them. So we're setting, now when the research for vaccines for COVID started, because of its nature, a special type of virus, you discovered that it was difficult. So, but in lots of research, because it was necessary, when scientists are pushed to the wall, they produce results.
Okay.
So what we're saying is that this eye-opener should not be taken for granted. It should be an opportunity for us to galvanize ourselves as Africans, put together a research institute that we need to look at not only COVID. COVID vaccine has been produced. All we need to do is work on the formula and then reproduce it. We're saying that it's an opportunity for us to look at African problems. Malaria is top on the list. Yeah. And we want to look at it. Other problems that needs vaccine and other research. We're saying that this research center is a center for excellence. And it's going to be for everything, including malaria.
I'll come back to you on the level of preparedness of IUO for this grant. But I'd like to get Prof. Yeah. They say a crisis is too important an opportunity to waste. A crisis is too important an opportunity to waste. So COVID-19 is a crisis. Okay. And we're saying it's too important an opportunity to waste. So it has opened our eyes. And we're saying we must have urgency. We must solve these matters before they happen. So our concentration is not on COVID-19. It's on all essential vaccines. We want to manufacture, we want to do R&D on all essential vaccines for the continent. COVID-19 is just one of them, and maybe we're too late for that one. Right now, we might actually have to do the manufacturing only. But for the future, for HIV/AIDS, for malaria, for so many other infectious diseases, we're saying we've woken up. And we're going to do research across the board. Now, you ask, why were we not working on malaria? Yeah. Because Africans had no urgency. We were just working depending on donors. Who gives us our vaccines? Gavi, Global Fund, UNESCO. We want to move away from that traditional, what we call the global healthcare infrastructure, where we, as Africans, are not spending enough money on our healthcare. We're depending on Gavi, Global Fund, and World for donations. Okay. And when they donate, they tell you don't work on malaria, it's not important, but they tell you what to do. Yeah. But if you and I are putting money into research, you say, we have a problem of malaria here, sickle cell anemia, and then we can set the agenda. So going forward, African money must drive healthcare on the continent. We must be investing the 4%, whatever number that we agreed upon, of our GDP in health. And then that way we can then decide. COVID-19 has been active because it's global. And some of these diseases are affecting us, and no one cares about them except us. Now, with the efforts we're carrying out now, we're saying, going forward, we are not going to listen to WHO. We're not going to listen to Gavi or the Global Fund. We're going to listen to ourselves. The research we're going to do is going to be determined by us, not by America or Europe. Okay. But you can't do that if you have no center. You can't do that unless you're doing R&D. You can't do that unless you are manufacturing your own medicine, your own drugs. Okay. So we're very correct. We have woken up as Africans to say, never again should we be exposed the way we've been exposed under COVID-19. More importantly, let us address all our diseases by ourselves. Okay, Prof, let me get your take on the G21 Independent Task Team launch. Good. How ready is Igbinedion University Teaching Hospital, Igbinedion University Okada?
We're very ready. The Honorable Chancellor himself, the Deputy Chancellor, we're all on board. I'm the Chairman of the team, and we are very, very, very prepared. The program will take place on the 21st at the Igbinedion University Okada Hall. The multipurpose hall is being renovated to meet the first-class standard. We've invited several dignitaries across Nigeria and outside the country We have people from Senegal and other parts of West Africa already on ground. We're expecting a lot of dignitaries. We've also informed, definitely it's a health matter, so the Minister of Health and other personalities with respect to health will be available. We are also put on ground a panel of discussants. We want to be able to discuss the matter. So we have scientists, people who have been drawn from every part of Africa to discuss the way forward in terms of the problem of Africa, the issue about research and manufacturing of vaccine. So there will be a panel of discussants on that day. And also we have a lot of Zoom meetings. We want to be able to have Zoom meetings with undergraduates, school children, have their opinion. We are taking everybody's opinion into this matter. We want to have ideas from politicians, scholars, students. So on that 21st, the main thing is that we're going to have the official launch of both the tax team and also the program. And then from there, we're inviting other people who will be involved in terms of both financing and other part of it to ensure that the program starts from that day. We want to be seen, running immediately with the dream, so that at the end of the next few months or years, we should be able to say yes, an African vaccine has been produced in Africa, in Nigeria, for Africans.
Okay. So what we are saying, the 21st of June is a great African day. Nigeria is simply a launch pad. On the 21st of June, we're starting a great African journey to vaccine sovereignty, to vaccine independence. Where as Africans, we say from the 21st of June, our journey towards vaccine sovereignty, our journey towards universal and equitable access of vaccines and vaccination has begun. So it's a great African day on the 21st of June, and Nigeria is the launch pad of the African journey. Thank you very much, Professor Authur Mutambara, former Deputy Prime Minister of Zimbabwe, who is also a researcher, a scientist, a robotic engineer. I mean, a man of different parts. I want to thank you especially for obliging us this exclusive interview to learn more about CoDA and the Independent Task Team for Development of Vaccine and universal access to vaccines and vaccinations for Africa. Professor Bazuaye, thank you again for coming, and we wish you the very best on this project. And I know that with someone like you on board and the other, crack team, academicians in Nigeria and beyond, this definitely will be a great success. Yes, Prof. Yes, I want to say a parting shot. Parting shot. I want to say to Africans, you will never be respected as an African until the African continent is done well as a continent. You can say I'm a superstar journalist, I'm a superstar academic, I'm a superstar business person, I'm a rock star. You are no rock star unless the African economy is a rock star economy. You are no rock star until every African on the continent and in the diaspora is a rock star. Take it personally as an African to change the conditions on the continent to make sure we all succeed as Africans on the continent and in the diaspora. Fantastic. So this is a pan-African ideology. Thank you very much. We'll sit here on Monday with yours sincerely. We'll continue the rest of the program right after this time out. Stay with us.
This is ITV. Certainly the best.